Hi, everybody. Welcome to 9 to 5 with Yona and Lisa. I am Lisa Carberg. I'm a former newscaster.
I'm Yona Gregory, and I'm an attorney in Connecticut.
And we have a special guest with us today, Vanassa Sebastian. Thank you for letting us come into your business here. This is awesome.
And being on our show, we have an actual celebrity on our show today who's been on
Bravo.
It's what everybody wants, to meet.
And you're shooting again, right?
Yes, we're going to be filming.
Welcome, Vanassa. You have an impressive list of credentials. You are, run us through what you are medically.
So I'm actually a registered nurse, and after about 5 years working in the ICU and ER, I decided to go on. I wanted a little something more advanced practice, so I decided to go into anesthesia. So I am a certified registered nurse anesthetist. I give anesthesia in the operating room 1 day a week. I also have my advanced practice registered nursing license.
Impressive.
And about 3 years ago, I ventured into the world of medical aesthetics.
MedSpa.
Yes.
And now you're one of the few people who have a certain credential. Now, CANS, right?
Yes.
Can you just explain what that means?
So-
Because only 2 of those in Connecticut.
That is correct.
Yes.
So I'm actually certified as an aesthetic nurse specialist. So I'm board certified. I had to take a board certification last year, and I passed. Of course, the studying was grueling, but I'm very grateful. I have a huge support team, so I was able to pass. So there's
I just want to say, if you're in anesthesia and you get a patient comes in, the last thing they want to do when they see your face is go to sleep. So you probably have to give them extra.
well, it's really funny because, as much as I love anesthesia, it's definitely not as fun as medical aesthetics. I mean, all my patients are sleeping.
Right,
Yes,
right.
right.
I
yes.
want
So
to
you're-
enhance their beauty.
So while we're here, you're branching out. You're taking the next step, like we have with 9 to 5. Tell us about that.
Yes, so I'm currently located inside Northeast Plastic Surgery Center, and I work
In Old Lyme.
And by the way, we hope to have Dr. Pathy, who is this head surgeon here and renowned for certain surgeries, such as breast augmentation and tummy
is
tucks.
correct.
He really specializes.
laser?
So
He is
Smart
actually,
lipo?
he's board certified plastic surgeon. He is actually the best. We have people flying in from all over the country to get treated by him.
we're going to have him on the show, but we'll talk about that another time. But definitely, he's going to be exciting. I know having him on, I'm going to want every surgery he talks about. So I'm a little worried about. It's like a kid in a candy store.
You could do it all at once. She could put you under, and then you'll start from head to toe.
And I actually do. I give anesthesia for Dr. Pathy in the operating rooms on Mondays. But I am branching out. I will be moving across the hall from Northeast Plastic Surgery Center.
We're on Davis
In
Drive.
your independent space, and I've seen a preview of it. This space is amazing. It's going to be the most glamorous, beautiful med spa in the area.
How many treatment
And
rooms?
I have 4 treatment rooms. There's 1,400 square feet, 4 treatment rooms, a huge open area. It's going to be gorgeous.
And I'm in
super
charge
excited.
of open house committee. I'm self-appointed. I'm just telling everybody that, and so don't dispute it with me.
And we may
we're
open
gonna
a
be
pop-up
filming.
satellite office there,
Right,
studio.
yeah, and we're going to be filming the open house,
Yeah.
so that'll be so exciting. But I just want to say to our audience one thing, just to let them know how we met. This
Yeah.
is really interesting. We are friends in real life, and we met at about the age of 19 or 20. It's unsuspect, but
19. It was 19.
bartending in a very divey bar, and neither
it was
of us.
that bad.
It was divey. It smelled like
It was
sewage.
bad.
It was bad. But we didn't even at the time know what alcohol barely was. So people would come up and order like a vodka tonic, and we would be reading the bottles like gin. I didn't
think
even know it was clear.
I think I asked you how to make a fuzzy navel. I was like, what is there gin in a gin and tonic?
But that just goes to show you where we started and where we ended up. So we worked really hard. It was not the greatest or glamorous job, but it was a means to an end.
Yes.
And look at you guys now. You're still friends,
Yeah.
and
Yeah.
you're empowering women. And I think
Yes.
that's one of our themes today.
Yeah.
Yes.
And that's what we really want to talk about, because a lot of people, I think women think of aesthetics as, medical aesthetics as superficial, or, oh, I don't want to look fake and all of this. But when I posted about this show on Facebook,
Yes.
the response I got, I was floored. All of these people that
true.
had been treated by Vanessa, forget Yelp reviews, forget anything. These are real people that were coming out and saying, this woman changed my life. I've been in a car accident. What she did to me changed my life. I'm no longer depressed clinically.
Right.
I mean, a lot of it doesn't just have to do with superficial and fluffing. It has to do with changing and empowering women
Feeling
by
good about
making them
yourself.
feel good about themselves.
Yes.
So it's not like you go in there expecting to have a brand new face and you're going to be so fake.
No,
A
you
lot
don't
of
want
it-
that.
No,
You
it's
want-
there's definitely this huge level of empowering women in what I do in medical aesthetics, because, it's definitely true. When you look good, you feel good, and when you feel good, you do good. So it's very important, and it's a big part of what I do. I mean, I've had women come into my office who were either post-divorce or post-losing a child, and they really just lost themselves. And then they, they'll send me an email or write me a little note telling me how much I have changed their lives. I don't think that I have done it. I've just helped them get to a point where they actually feel better about
Giving them
themselves.
confidence and paying attention to them, and you listen to them, and you're very nurturing in the field that you do. You're not just an injector, just out of nursing school, got one certification and just starts injecting randomly in someone's face and not listening to them. You're the whole deal. And I just want to say that your patients, I was floored. There are so many testimonials that they posted on our site, unsolicited, just telling their story. But so now the theme of our show today is we want to tell you what you need to do to get the most bang out of your beauty bucks. So there's millions of...
you don't have to spend a fortune.
You don't have to spend a fortune. There's so many things that are out there. I'm constantly reading about a new, type of treatment, and it's kind of a fog. I don't know exactly what's right for me. I don't want to spend a ton of money, but I want to do the most effective thing for the money and the budget that I have. So let's say, Vanessa, if you are a woman, working woman, and you don't want to spend $10,000 on a facelift, what are some things that you can do that are minimal cost, no surgical efforts, and are very effective?
Sure. Well, the first three things I think that every woman needs in their beauty toolbox is they definitely need a sunscreen every day.
Yes.
They also need a vitamin A.
Okay.
And they also need a vitamin C. Those are three key ingredients.
So those
I
are
think
good for
that
your skin?
Yeah.
Very, very
Okay.
good and nurturing for the skin.
So-
I also recommend, a little bit of Botox. I know people are really afraid of it. It does not change your face.
Right.
All it's doing really is just relaxing the muscles. And, Botox has been proven to be not only corrective in terms of you seeing the wrinkles really relax and not see the wrinkles on your face anymore, but it's also preventative.
Oh,
I mean, it's
definitely.
been definitely proven.
Yes.
Botox is preventative.
Yes, I can attest to that. I was getting Botox since I was about 35. And, it's not that it's something I should be embarrassed about. I started it as a preventative measure.
So the wrinkles
The
can't
wrinkles
form.
never formed.
Exactly.
And I don't feel like my face is frozen or fake, but my face is preserved so that I never had all of those wrinkles. So I went at it in a preventative way, and I was lucky to do that and have the foresight. But even if you didn't do it preventative, can you still get an effect from Botox, a treatment?
Absolutely. I mean, women do Botox all the time now, and you don't have to do the entire face.
What's the most popular
can-
area?
The most popular area is obviously right between.
worry line.
Yeah.
Yes, right between this
Yeah.
glabella area.
Yes.
Everybody wants that glabella area nice and smooth, and it's not just for women; it's especially for
Right.
men.
Yes.
Right.
I
They have
had
to
a
have an
gentleman.
edge.
Yes.
I had a gentleman that I treated last week, and he came into me, and I said to him, you look so happy. And he said to me, no, that's your Botox. It's because he didn't look so
Yes, stressed out.
neat. He didn't look
Yeah.
so stressed.
Worried.
He didn't look so serious.
Intense. Yes.
And is there any
And so-
other treatment that you recommend as far as, budget friendly for women
Sure.
and men too?
Sure. Another treatment would be microneedling. Microneedling is amazing.
Is that what they call, celebrities call the vampire facial? Sounds worse than it is, right?
So yes, so a part of that vampire quote unquote facial is also there's microneedling involved in that.
Okay.
So microneedling, there's a pen, it's an electric pen, and we create little tiny pinprick microscopic holes in
kind
your
of
You
face.
numb the face first,
We
right?
numb the face
Okay.
first,
It's like perforation in your
yes,
skin.
and
Okay.
it creates little channels so that when we put the platelets on, or I put a hyaluronic acid on over your skin, after we've created these channels, it can actually absorb into those channels and actually get into the dermis.
And we've both had this done.
Yeah, we both had this done. And just for the viewers to know, these are the two treatments that we're going to be doing in our next segment following this one. So we're going to be doing those treatments. We're going to be undergoing them and taping the whole thing.
I'm the
for
Botox.
Our viewers, and I'm the microneedling.
I like it because it gets rid of my headaches too. Not that
that's
I
a
get
good
a
thing.
lot,
Yeah.
but when I have Botox,
Yeah.
I don't get headaches.
Right.
And I like that.
So, and beyond that, now when you're expanding to your new space, are you going to be offering more treatments that are maybe more expensive or more on your surface skin?
Absolutely, absolutely. We will definitely on our menu of services have all kinds of. We'll have some options for lower budget like the microneedling,
Okay.
and then we'll also do some facials. I'm going to have an esthetician that will provide
nice.
hydrofacials. We'll also have
Those
some
are good.
lasers, so we'll have
Okay.
laser hair removal, and we'll also have a couple lasers for skin tightening and surface
a
skin.
lot of these treatments you're talking about, are they things you have to do throughout the year, or is it one and done?
You know what? Listen, some of the best results that I get are the patients who really invest in themselves and do a little bit over time.
Yes, right.
It doesn't necessarily, it
that's
doesn't take, one visit with me for me to reverse for me to reverse,
Right.
you know,
Right.
20 or 30
Right.
years of age, and it takes multiple visits, and it's an investment in you. You know, oftentimes everybody walks around with these $2,000-3,000 purses, but what's the one accessory that you take
We
with
would
you
never do
everywhere
that.
you go?
We would never do that.
Yes, but what's the one accessory that you take everywhere you go? You're taking your face with you.
Right,
So,
right.
You know, I
And it's
always
a first
recommend.
impression.
It's a first impression.
Yeah,
It's the
yeah.
first thing people see. So
It gives
I
you
think
the
it's
confidence too. It doesn't. It's just not your
Absolutely.
service, like we were talking about.
Right.
The empowerment. It comes from outside and it goes inside too. But if you look good, it is true. You feel good. A lot of the confidence I get in my work, because I'm, as I mentioned, an attorney. I have to go places and speak out in public, and
Go to
I
court?
I had a phobia of that when I was younger, like a legitimate phobia.
Really?
But
Yeah.
part of it is when I walk into court and I'm always dressed up with the heels and everything. I feel like I look good, and that's just the first step. And then when I open my mouth, I already have some confidence. So it goes beyond
Right.
just the
It
superficial.
definitely is. You know, there's physical beauty, but there's also inner beauty. And I think part of what I do just kind of brings out, I bring out the best version of all of my
Exactly.
clients.
And
I bring out their inner
true.
beauty and the best version of them. And if they feel good and they look good, you know, they're good in so many other aspects
I
of their
just
life.
want to say one thing about inner beauty. So many people that posted in response to Vanessa being here, one thing they always say is that she's not only beautiful on the outside, which we can see, she's
so
beautiful
sweet.
on the inside. And I think that having your patients say that, people aren't your relatives, they're saying you're beautiful on the inside, it's just a real testament to what you're doing. You're doing what you love, you're investing your heart into it, and people recognize that.
You know what, I have to tell you, I feel so incredibly blessed because this is truly my passion. And it truly is my passion. I love
nice,
doing
yes.
this. And
And
I
it
prayed for
shows.
this.
It
I prayed for
shows.
this. I honestly, I prayed to be where I'm at today, to be able to be in a position to do what I'm doing. And,
Yeah.
you know, sometimes I work 12 or 14 hours a
She
day.
does.
And I said to my
And you
husband,
don't eat. And
It doesn't feel like
and I'm
it.
like, I don't feel like I'm
Doesn't
working.
feel like
I'm
work.
like, I don't feel like I'm working.
Yes, it's
I
so
like
true.
I'm hanging out with my girlfriends, making them pretty.
Yes, we are going to go to our next episode. I'm going to have to strip off all this makeup. You actually may not recognize me in the next part, but I guarantee it's
Especially
me.
after. You were so
Especially
brave.
after, yes.
Yeah, but you know what? You have to also just let them know what it does for your skin,
Yes.
because I know that we've done
I just
it
want to say
before.
one thing, and we're running to the end of our time, but I had invested in a really expensive treatment that was supposed to work on this area and sort of pull back your skin. It was thousands of dollars, and I invested in it.
Thousands of dollars.
For real. And I didn't really see a result. And I don't want to say what it is. It wasn't with Vanessa. It was somewhere else. And then I started doing the microneedling regularly, once every 6 weeks. I only got 3 treatments. My before and afters with just the microneedling
It's impressive.
were incredible. So I can testify to that being a great treatment for a lower
Yeah,
budget.
I've had it. I loved my skin
I
after.
love it. And
Oh.
I had 2 weeks downtime with the other one. I didn't, first of all, I just have to tell this one story. I didn't expect much downtime. I didn't read much about it. And the doctor didn't tell me.
Right.
But the next day I had scheduled court. I'm not going to lie. I looked 100% like the nutty professor. You even agreed. My
Totally.
face was double. And I had 4 chins. And
you
still
look like
went-
you'd been strangled.
I still went to court because I can't continue my clients' cases because I don't feel good.
Right,
And I
right.
went to court. People were just looking at me like, what happened? So I don't recommend that. But anyway, we are going to move to the next one. We're all going to get ready for that. And we look forward to seeing our audience and allowing you to see our results and treatments.